Hi, welcome to another episode of Youth Diary. When we think about the common illness in our society, the two common problems that come to our mind are diabetes and hypertension. So today we are going to discuss about diabetes. In simple words, I can say diabetes is a group of metabolic diseases in which a person has a high blood glucose level. Let's find more about diabetes. So today we have Dr. Pradeep Sreedhar with us. He is a diabetologist from Calicut. Hello doctor, welcome to our show.
Thank you.
When we talk about diabetes, it is one of the common problems that's seen in all age groups. So can you just explain me what is the diabetes and what is the incidence of diabetes?
Diabetes is a metabolic disorder affecting the beta cells of the pancreas, whereby there is destruction of the beta cells and thereby the patient has very low insulin levels in the body, which is insufficient to maintain a good glycemic control. And if you talk about incidence, there are two types, type 1 and type 2. We talk about type 1 diabetes. The incidence, actually it's about 5% in a child if one parent is diabetic, and it's about 15% if both the parents are diabetic.
Okay. Doctor, our young friends have got a few doubts about diabetes. Let's watch that.
Hi ma'am, I'm Jaswin. I'm working in Dublin Healthcare. Can you please tell me about the early onset of diabetes in the younger generation?
Yeah, as I said, early onset of diabetes. So diabetes is basically two types, it's type 1 and type 2. So type 1 diabetes is what you see in even at birth or maybe at a very early age before adolescence. Whereas type 2 is something, earlier we used to see type 2 only beyond 40 years of age, but now we do see type 2 at much earlier age, around 20-25 years, because of various lifestyle changes and dietary habits, etc. So when you talk about early onset of diabetes, in type 1 the basic problem is an autoimmune destruction of the beta cells of the pancreas. So thereby the patient has absolutely no insulin in the body, the child, So he'll have to be on insulin therapy lifetime. So when you talk about type 2 diabetes, again, there are various reasons why the early onset, prematurity at birth itself is a major factor, which you notice because babies born premature are prone to become diabetic at a much earlier age.
That is in type 2.
Type 2
diabetes.
Type 2,
okay.
yeah.
And in type 1 you said, sir, doctor, that is in a much early age group.
Yeah, type 1 is again autoimmune destruction of the pancreatic cells.
Usually
so that happens at birth or maybe at the early infancy.
Since birth the child is...
can be diabetic, at the early infancy, before adolescence. But type 2 appears a little later in life. So type 2 again, as I said, premature babies, later in life they become, there's a good chance of becoming diabetic. And then of course dietary habits, obesity is a major factor. Obese children, they are prone to become diabetic at a later age. Dietary habits, children who are actually eating more of carbohydrate food like ice creams, chocolates, they all are prone to become diabetic.
For
and
type 2.
Type 2. Regular exercises is very important. So those children who are, nowadays you see most of them sitting in front of the television most of the time. Yeah, absolutely. So they spend more time in front of the television, and that's the time they eat more, kind of binge eating. They consume all aerated and harmful food, which again predispose them to diabetes at a much earlier age group.
So in this, which type is more common?
Type 2 is more common. Type 1 is not that common. Of course, as I said, it's much less, but type 2 is more common nowadays. And we do see type 2 at a much earlier age group now. That is what is more alarming. Because earlier days, we don't even think of a patient becoming diabetic beyond earlier than 40 years. But now the whole scenario has changed. Now we do see type 2 at much 25 years.
So does a lifestyle affect this?
Of course, lifestyle. That's why I said, it's mainly because the lifestyle changes. Children don't exercise. They eat all kind of junk food. They spend most of the time in front of the television. They don't go out and play. And then apart from that, there are various other factors also. As I said, there are certain rare causes which can also lead to type 2 diabetes in later age, like maturity onset diabetes in young. Various other reasons also. Cystic fibrosis is one thing. Children with Down syndrome are prone to have diabetes at a later age. Those are all rarer causes, but I'm saying mostly the main causes are again the lifestyle change.
So doctor, we'll move on to the next question.
Yeah.
Hi ma'am, I am Ajesh Matthew, working in Dovin Healthcare, Leela Info for Kakna. Could you please explain what are the complications of diabetes in younger age group?
See, when you talk about the complications of diabetes, we have to say both the acute as well as the chronic complications. So if you're talking about younger age group, it's more the acute complications that are predominant here. So when you talk about type 1 diabetes, the commonest complication that we encounter is diabetic ketoacidosis, which is a very life-threatening problem, medical emergency, which has to be tackled immediately. There again, there's absolutely no insulin in type 1, there's no insulin left in the body. So you may go into a ketotic state, which can even be very dangerous too. And another thing is about acute emergency is a hyperglycemic hyperosmolar state. That is again more common in type 2 diabetes. The management is again, you have to, for in ketoacidosis, you have to be supplementing with adequate hydration, adequate parenteral insulin therapy. You have to supplement electrolyte correction, like potassium replacement, bicarbonate therapy. These are the main things which you need to correct such an acute emergency situation. But again, if you talk about the chronic complications, we all know diabetes is a disease which can affect most of the target organs in the body, like the heart, the kidney, the eye, the nervous system. So the most commonest complication what you see is about diabetic cardiovascular disease, diabetic eye disease, or diabetic retinopathy. When it affects the kidney, it's diabetic nephropathy, and then the nervous system is affected, it is diabetic neuropathy. And then you have autonomic neuropathy again, it's a problem. Sexual dysfunction is a problem in diabetes. Foot problems, it's very common nowadays. We see
they get ulcers.
Foot ulcers, diabetic foot ulcers is very common. And then we do get a lot of skin problems in diabetes. Gastrointestinal problems in diabetes, it's a very common thing.
I think it affects most of the organs in our body.
Mostly all the organs, and primarily those target organs, which are the heart, the kidney, the eye, and the nervous system. And then of course other organs also, even the joints are affected. Rheumatic disorders in diabetes is also quite common.
So doctor, you have already talked about the complications, but let me ask you something. What are the symptoms of diabetes?
Symptoms, the usual triad of symptoms, like they call you polyuria, polyphagia, polydipsia. So polyuria means there's infrequent urination. Polydipsia is increased thirst, and polyphagia is increased appetite. These are the commonest complications that you notice in the initial stages of diabetes. Then of course you see a lot of weight loss, fatigue. These are the common things which you encounter.
So it is always better to get their blood test or urine test done when they have at least any of these.
Yeah, of course. These are actually the kind of markers, these are signals they give you. So they, when you find such symptoms, it's always better, and especially if you have the patient has a family history of diabetes, his parents are diabetic, and he's in that particular age group where he's prone to be diabetic. So in such situations, when you have such symptoms, it is always better to go in for a periodic blood sugar estimation.